Hey there, my name is Carolina, and today we'll be discussing ambulatory care, which is a growing field for nursing. What is ambulatory care? According to Heinrich, ambulatory care is any service that is not performed in a hospital or facility that requires admission. So we're talking about healthcare services in a clinic or a dialysis center or within the community at large. Who works in ambulatory care? We have CNAs, MAs, LPNs, registered nurses, masters of nursing, nurse practitioners, physician assistants, and physicians. So what do nurses do in ambulatory care? It very much depends on the setting, based off of the specialty and your location and your job description. Some tasks include case management, medication administration, medication refills, wound care, taking vitals, phone triage, assisting with procedures, scheduling appointments and imaging, and as well as triaging referrals. So in my specialty clinic, we have providers send information on patients who may have a vascular issue. And I've been given the training and can do a little bit of assessment looking through those charts to see what's most appropriate, if that's a service that we can offer, and if not, where can we refer that patient on to make sure they get the care that they need. In addition, nurses in ambulatory care can provide mental health support because they've had that piece of their education. They've done those clinical hours and those projects that provide a good foundation to different mental illnesses and what to watch for and how to support our patients. As an RN, and especially as a bachelor's of nursing, with the bachelor's nursing degree, there is extended leadership education that can really help in a clinic to define those roles and to lead the team. RNs can provide education within a clinic, and that is something quite specific to their role. RNs can specialize and certify in specialty areas like wound care and diabetic education to provide that extra support and provide holistic care and really educate on lifestyle choices and things like that. So why do we need RNs in ambulatory care? What has changed? We see an increase in chronic conditions worldwide. Due to these chronic conditions, we have people going to the doctor more often to manage a long-term illness rather than one visit or two visits for a broken arm. RNs, with that education and with that experience, can provide leadership that is very patient-centered. RNs can delegate and train their staff and assess competency. RNs can advocate for global wellness within their communities and provide education, support, and cultural awareness. The example that comes to mind is the nurses that work with the Panhandle Health District. They do prenatal classes, they do sex ed classes, they do drug safety classes within the schools and with families and parents. The RN in ambulatory care is in a really great position right now to help guide policy change. As it stands, roles are not well defined because we're moving from a structure that had 2 or 3 clinical staff to several layers. For example, my clinic is moving to a structure that includes physicians, physician's assistant, an RN, an LPN, and medical assistants. So to figure out where those lines cross, where they blur, and what roles are specific to the person working with that license. RNs can also influence policies around insurance companies, and what coverage is needed. There's a huge need for policy change around patients who have the veterans insurance, for example. Now, is ambulatory care the job for you? Ambulatory care does offer consistent hours, often Monday through Friday, and those hours work really great if you've got young kids at home and you need to work around school or daycare. Ambulatory care utilizes the soft skills of nursing, so that communication, that active listening, leadership, rather than an IV or Foley, for example. In ambulatory care, you work really closely with your team, both in schedule and on cases and physically. So you learn really quick if that team is a good fit or not, and what culture is of a place. And you can change that with effort and time. But it is something that's very unique. Where on the med-surg floor, you alternate, you rotate, and if there's a personality conflict or if there's a conflict between two people, you have a little bit of space, you have a little bit of a buffer. In ambulatory care, you work closely with providers, patients, and insurance companies. So you, for example, an insurance company might call in and ask, why does this patient need this certain study? And you can work with them and talk through the visit notes and give the why behind the what, and that can help them authorize and pay for different studies. In ambulatory care, you see many patients in a day, but if you stick it through, you get to build long-term relationships. So some patients come in every 3 months, some every year, but you get to see and build those relationships over a long period of time. Now, do you have any questions? Thanks for listening.